Hello, everyone. Hi, welcome to Qutis Clinic's Cool Sculpting virtual event. I am going
hundreds, thousands of people. Like last night, the event of Apollo is about 3,000 people, and they're all there not wearing masks, enjoying.
I can't hear anything. Can someone sort the audio out?
Can everybody hear me? If you can't hear me, you can message me in the chat. And I believe we should have videos and microphones turned off now as well. Great. If you can't hear me, please let me know down in the chat box. Otherwise, we will start. Okay. So let me start again. I'll introduce myself and my colleague. This is Helena Impey. Helena is one of our advanced aesthetic therapists and works across 2 of our 3 clinics, both of the clinics that offer cool sculpting. So she works at our Tame clinic and our Hemel clinic, which is where we are today. And my name's Angela Hunt, and I'm a registered nurse, and I lead our cool sculpting across all 3 Qutis clinics as well. Today's event is a focus on cool sculpting. We're going to try and keep this succinct and just to the point and give you an outline of what cool sculpting is and how it works. So I hope to be wrapped up in about 35-40 minutes maximum. All right. There's an opportunity for questions at the end. So if you have any questions, just type them into the chat box and we'll address them at the end. But equally, this is really informal and there's only a few with us today. So just ask questions as we go and we'll try and address them. I am recording this, so apologies if I was on mute at the beginning, but I am recording this. So anyone who is unable to join for all or some of the event, I will send you the recording at the end of today, along with an invitation to book a free of charge consultation. Okay, so what is cool sculpting? In simplistic terms, cool sculpting is a permanent way to reduce unwanted pockets of fat through freezing them. It's that simple. It's the only alternative to liposuction. So cool sculpting's been around for, gosh, is it 13, 14 years now?
Yeah, it's pushing 20 years now.
It is quite, yeah. So it's the only FDA approved and CE marked technology for cryolipolysis. Cryolipolysis is a scientific word for freezing fat cells to permanently kill them. FDA and CE marked means that it's safe and it's the only alternative to surgery. All right. The areas of fat that we can treat. So this is really important because this is one of the first questions we get asked during consultations. Where can you treat and which pockets can you permanently remove? Helena, I'll let you talk through this image. You can use my body.
Yeah, so I'm just going to use a little pen to point out. So first of all, on the face. So we can treat here under the chin. Then we can go down the body and we can treat here. Bra fat. So if you wear a bra and you've got that little puff of fat, we can actually treat that area. We can do the upper arm. So we're talking about here, around here. We can also do the back, so the upper back in this area here. And as we go down, we can go down the whole of that back area and do the lower back under our waist and also above our waist, which we call the flanks. We can also treat the whole back area, and then we can go then down from the waist down, which is then we're treating things like saddlebags, under the buttocks, which is called the banana roll. We can treat the inner thighs, and there are some areas that we can treat which we don't necessarily do on everyone. It's down to each individual patient. So that's like around the knee area. And as I said, we can do the whole back area. So it's kind of top to toe. The only area we wouldn't really necessarily treat is under the knee. So the calf area, around the ankles, etc.
And it's because that's a really difficult area to take a specific pocket of fat and remove it from the body. We are permanently removing unwanted pockets of fat. So Coolsculpting is fantastic for those that have been trying to lose weight, but you just have, and I'll say this over and over, but you just have those stubborn pockets of fat that won't shift. That you're the perfect Coolsculpting candidate. It's not ideal for someone who is overweight in general and looking to lose anywhere from sort of 6 to 10 kilos upwards.
So
it's mostly not necessarily applicable to those patients.
So that's like a couple of dress sizes, isn't it?
It is. You will see a reduction in inches, especially if we're talking waist or thigh, but it's more about the contour and the shape of how you fit in clothes and how you see yourself. That would be the biggest noticeable difference.
So when you put an item of clothing on, how you look in that item of clothing. If in some areas it's a bit tight, you can see a few bulges. It's more about that.
How it works. So this image is really helpful actually, because this is quite literally what we do. So first we palpate, we feel those unwanted pockets of fat, and we all do it on ourselves. I mean, we all sort of grab our bodies, don't we? And think, oh, I don't like this bit, but that's what we feel for. Coolsculpting only works on subcutaneous adipose fat cells, all right? It doesn't work on the fat below the muscle, which is called visceral fat. It only works on the fat above the muscle, just below the skin. This is a really good visual image to give you an idea of what happens during the procedure. So depending on the body, the area of the body that we're treating, and the size of the pocket of fat, but overall, we place an applicator on, and on average, it's on there for about 35 to 45 minutes. And during that time, we take that pocket of fat, which you can see in the first image going to the left, and we freeze those fat cells. Now, I just want to add in at this point, we produce all of our subcutaneous adipose fat cells in our developmental juvenile years. We don't produce any more fat cells in our adult years, nor does our body destroy fat cells. What happens is those cells either expand or shrink with diet and exercise, so based on our lifestyle. So if you, and this is a really good kind of anecdotal story, if you know anyone, or if you were someone who was overweight as a child, you may find that now if you sort of think about food, you put on weight so much easier. It's because you developed and carry more fat cells than somebody else. Now, genetics and everything else will play a factor, but those are variables to consider. So first image, fat before we treat you. The second image is during the treatment. So we're taking that pocket of fat, and on average, think about the sort of size of your fist, if you like, open hand, and we're freezing those unwanted fat cells. We're aiming to kill 27% of those fat cells. So it takes the amount of time, 35, 40 minutes, to bring that fat down to a temperature to cause cellular instability, and thereby causing apoptosis, which is cellular death. We do a 2-minute massage once we take the applicator off, and this is per pocket of fat this process applies to. 2-minute massage to encourage circulation back to the area, because in your circulation is your white blood cells, which are like your little soldiers that come in and finish the destruction of the unstable fat cells. And then over the course of 12 weeks, your body will naturally remove those dead fat cells. So it's a slow process to see the results. However, in that slow process means it's very, very minimal impact to liver, kidneys, spleen, because it's just a natural drainage of the unwanted fat cells, and you don't notice it.
No, it's slow and steady.
Yeah, you don't suddenly have a weird bathroom moment or anything like that. You just kind of forget about it, basically. And again, it's a good visual that what you can see here in terms of 27% reduction. So another good point to make, and this is based on a few clinical papers I've read recently, if you want to think about body fat percentage in terms of scales, if you're using a metric scale, a digital scale, think about 20% reduction in the target area is what we would look to see of a reduced fat amount. Again, really nice visual. So before Coolsculpting, after Coolsculpting. Again, it's not a course of treatment, Coolsculpting. It's like liposuction in the sense that you have it once or sometimes twice, depending on how much unwanted fat is in the area. So if you think about reducing that by a quarter, think about the unwanted pocket of fat or area of fat that you have. A lot of our patients are menopausal or postmenopausal, which means our estrogen levels have changed. And testosterone levels have risen, estrogen's dropped. And despite being on hormone replacement therapy, it can still have an impact on how we store fat, which we increase our storage of fat within our midriff going through menopause, unfortunately. So we sometimes, most often actually, our patients are that kind of cohort, and we look to just target that area and reduce it. I'll show you some photos later on, but this is a good visual. And again, depending on how much you have and how much you can pinch is more likely to depend on how many treatment sessions you'll require, but on average it's 1 to 2. The difference between Coolsculpting. So this is, why would you have Coolsculpting over liposuction? Because it is the only alternative to liposuction. I don't even compare Coolsculpting.
There's nothing else on the market here or in America or in Europe.
No.
It is literally Coolsculpting or lipo.
Yeah. That's it. So the science behind Coolsculpting, thousands of clinical papers, peer-reviewed clinical papers, last I read, over 7 million people treated, and that's 2 years ago. So it's increasing in popularity. So it's probably nearing 9 million patients treated worldwide with Coolsculpting. We've treated over 5,000 within our practice in the last 3 years. So going back 4 or 5 years, 7,000 probably. But the science, so the difference between Coolsculpting and any other cryolipolysis technology on the market, there's something called thermal detect in the applicator. So this is now how safe is Coolsculpting. So thermal detect monitors the temperature of your skin during the treatment, because we only want to freeze the fat cells. We don't want to freeze the skin on the outside. The cooling isn't strong enough to impact the muscle, although thermal detect is monitoring all of that. So during your treatment, we have a device that connects us to the machine wirelessly, so we know, and the machine will tell us if your tissue becomes too cold or not cold enough, and it would stop itself. It's rare that this happens, but it does occur. If it happens, we either switch to a different area and then go back to that area, or we would pause treatment for the day and then have to reschedule for another day, depending on how the patient's feeling and how the tissue's looking. Patient feeling in terms of if they've been with us all day and they think, you know what, I'll just come back to finish it.
Yeah.
But otherwise, that's sort of it. Safety. So where did Coolsculpting come from? I think is probably the best thing I can go back from here. So back in the 90s, there was a dermatologist in pediatrician, in Mexico, and he started observing pock-like marks on the inside of children's cheeks. So they all had this indentation in the inside of their buccal cheek, the fatty part of their cheeks, and he documented it and sort of theorized that it was in relation to sucking on ice lollies, because that was the only common variable he could come up with for this group of children. And he documented it and shared it with his peers. A few years later, it was later observed in Canada, which is where I'm from, by a dermatologist in female equestrian riders. They were presenting with, again, a dimpling on the outside of their thighs. And he then saw the clinical papers from the doctor in Mexico and likened them together. It was from riding in extreme cold weather, and we had this dimpling of outer fat on women's thighs. And from there, University of Michigan, in relation to Harvard University, created the science of Coolsculpting, which was cryolipolysis, because it was later proven that our fat cells are particularly sensitive to cold. And it's the only way, in the absence of surgically going in and removing these pockets of fat, that we could kill fat cells permanently. And I use that word permanently a lot, again, because it's not a treatment you keep coming back for. We're permanently sculpting you, which is why we wouldn't treat below the knee. We only want to reduce and sculpt patients in a complementary way because we're permanently removing pockets of fat. So how Coolsculpting works and the consultation process within Qutis clinics. Again, like I said earlier, after today, we would send you an invite to come and see us for a personal consultation. I'm happy to do these virtually, but it is nice if I could see you face to face, either of us could see you face to face at either of our clinics. And that way we can assess your body appropriately. We'll put together a personalized treatment plan, and we can explain how your treatment journey would go. But instead of us telling you, we're going to let one of our patients tell you how the treatment journey was for her. And we'll go into a bit more detail after this. So bear with me, I'm just going to do a bit of technology and swap over my screen sharing for one moment.
I felt that even with diet and exercise, there were certain areas that just weren't shifting and became a sort of bit of a bête noire on my back. So I felt that Coolsculpting would be a good treatment. I think I liked the lack of downtime. I chose a reputable clinic, and I like the fact that it's painless. Absolutely fine. Everything was covered, very thorough consultation. I learned a lot that I didn't know before. All my questions were answered. I was completely happy. I was very, very well cared for. Everything was explained in great detail. Everything was explained prior to whatever was going to happen. I knew exactly what was going to happen during the day. So it was great. It was very thorough indeed. It wasn't painful at all. It was just a little bit cold, obviously, because of putting the gel on and the applicator heads. It just felt like a little bit of a suction cup. There was no pain. There was really no discomfort at all. Yes, absolutely. Because Qutis has a reputation, it's a nurse-led clinic, and the therapists are very experienced and, you know, under the umbrella of a medical aesthetic clinic. There really wasn't any recovery time. I felt a little bit numb in the area afterwards, and I was warned about that. And that did go on for a number of weeks. I can't say it was uncomfortable or I was inconvenienced by it. So there wasn't a recovery time. It was perhaps a little bit sore that evening, but yeah, mild discomfort. No, I suppose my only question was there a risk of a tissue damage with freezing it? And that was dispelled to me very quickly, so no concerns at all. I feel that it's given me increased confidence because I always felt that I had this bulge on the top of my bra. I had to have quite a broad bra because I'm big busted, and I've always felt uncomfortable. I hadn't wanted anyone to touch me on my back, always been a bit self-conscious. So that's really flattened it out nicely, and I'm expecting to see results ongoing. Yes, I would absolutely recommend Qutis Coolsculpting.
Thank you. So I'll go into a little bit more detail about some of the questions that our patient answered whilst showing you her before and after photographs. So pain, I think it's one of the most common questions we get. And yeah, does it hurt, and how will I feel afterwards? I mean, what do you answer in terms of pain?
It's not painful.
No.
If on the grand scheme of things, it's not painful. Maybe very slight discomfort, varies from person to person, but it's not like you're going to be anesthetized or anything like that. So it's manageable, it's bearable. I wouldn't call it pain at all.
No, pain's such a subjective word, I think, but uncomfortable or maybe weird is probably the best.
Yeah, weird. A lot.
Yeah, weird.
Yeah, weird.
It's a bit like the treatment itself is fine. It's weird, but fine. But it's the after, when we take the applicator off, when you've got that frozen pocket and we do the 2-minute massage. It's like waking up on your arm when you've got a dead arm and then the blood comes back to it. That's the best I can describe it.
Yeah, or if you've come from the cold when you were little and you used to put your hands near the fire and then you can feel that come back. It's just that same sort of feeling.
It is, yeah. But it varies from person to person, but painful is rarely a word we hear when it comes to Coolsculpting. And the reason, one of the biggest differences between surgery and Coolsculpting is liposuction can be anywhere from 12 weeks to 24 weeks of recovery and feeling tender and not being able to drive for a duration of time. You can drive directly after treatment of Coolsculpting, so you can bring yourself to the clinic and drive home. In fact, I think 99.9% of my patients have done that. I only ever had one patient that didn't, and that was because she took the bus anyway. But otherwise, you can carry on as normal. My one advice, because we're in holiday season now, is after you have the treatment, you will be swollen, not swollen like anyone would notice. So let's say we're talking about under the chin area. You can carry on your life as normal. You won't have a huge goiter or anything like that. However, you will be a bit puffy and swollen that you would notice in the mirror for a few weeks. So I say to patients, and that's the same for anywhere on the body, like menstrual swelling, if you want to think about the abdominal area. So I say to patients, if you're going away on holiday soon, don't have Coolsculpting a week before you go. 2 to 3 weeks pre going on holiday, no problem. But 1 week before you wouldn't want to go away feeling swollen and tender.
It's the same if you go on holiday and you're on your period, or even just eating, bloating, you just don't know.
I think so. So that would be my sort of advice in terms of an experienced practitioner, but otherwise very, very little recovery time at all. You'll just feel a little bit tender and a little bit numb in the treated area. This was after one treatment session, and these images are 12 weeks post-treatment. Now, when will you see results and how much of a result will you see? So as we've said before, 27% of reduced fat in the target area. So we do multiple paddles, if you like, within an area, because remember I said a paddle's about the size of your palm, your fist, of what you can grab, but we have multiple fat pads on an abdomen, for example, or even under the chin in the submental area. I can only freeze and kill fat cells. So if it's skin, not suitable for treatment, more suitable for surgery, but we would assess you during consultation and we would tell you we wouldn't treat if we didn't think it was, subcutaneous adipose fat. Now, Coolsculpting says you begin to see results from 4 weeks post-treatment, and we do have some patients.
Some people do,
that we speak to. We have a follow-up conversation with them to say, how are you feeling? They say, oh, I think I can see results already. Brilliant. The average person begins to see results at 8 weeks, and optimum results are seen at 12 weeks post-treatment. However, over 70% of patients continue to see results up to 6 months post-treatment. The great thing about Coolsculpting. So this is, I'll explain this image and then I'll say what are the brilliant things about Coolsculpting. So this patient is in her 50s. She is going through the menopause and was fit, healthy, had one child, but always struggled to shift her unwanted middle fat. And as she went into her menopausal years, it was even harder for her. So she had one treatment session with, I think it was with you, Helen, actually, and we treated her flanks and her full abdominal area. We call that treating to completion. And you can see the way her waist is sculpted from the side and the way her waist is sculpted in the front. She's not sucking in. In fact, she's breathing out in both images. This is 12 weeks post-treatment.
You can see the definition on her abdomen.
Yeah,
that second one.
She was really pleased with her results, and she just wanted to feel like her again, basically. But the beauty of this treatment result for someone like her is it's permanent. So now she was finding sticking to her healthy eating and exercise, she was feeling disheartened because she wasn't seeing results. So we put in hard work, and then we get a few weeks in or a couple months in sometimes and think, oh, this is exhausting and I'm not seeing what I want to see. When we kill 27% of fat cells in a target area, when you then diet and exercise, you see results so much quicker because you're working with less fat cells. And that's what she said to us since we've seen her. She's delighted with her treatment. And that's what most patients say. So this is a really good image. The before and after of these two photos are it's actually highlighting the inner thigh gap on this patient. However, she has had her abdominal area treated as well. Her inner thigh, so she's in her early 50s. She's had 2 children, and she did have her full stomach and her flank area treated, as well as one treatment on the inner thighs. This is 12 weeks post-treatment for the thighs. For the tummy, she had 2 treatment sessions, and this was 8 weeks post the second treatment session. I'll show you in photos to come where she started and where she ended up. The reason I'm showing you this for the tummy is this is a really good example of skin laxity and what you can expect. This is another really common question.
Very common.
So patients say, you know, what's going to happen to my skin? The younger you are, the less likely you are to see any impact on your skin in terms of loose, saggy skin. The more mature you are, the more likely you are to see a little bit of loose skin post-treatment. But it's really relative to, have you had children? Because has that skin in the tummy area, for example, already been stretched and gone back? So that impacts the elasticity and the collagen and how well your skin bounces back. Your age and just your skin quality and how much fat we're reducing. So on this patient, she is a petite woman, and you can see it really from her hips and her thighs, but she carried all of her weight in her middle. So in losing it from the start to finish, she ended up with that little bit of skin laxity. However, I'll go down to another photo. I'm going to come back to that photo in a sec. This is her from start to end. She wasn't bothered by her skin laxity. Again, this is a very personal thing for each patient. For her, she just wanted a flatter, smaller stomach for dresses and clothes. And that's what we have managed to achieve for her. And you can see, looking at the front photo, so she's been on a 2-week all-inclusive holiday, I want to add.
Perfect time.
All of our patients seem to have Coolsculpting kind of early in the year, and then they've got beach bodies and they go on holiday. But it's great to see, because she thought she'd put on weight, even though she felt smaller in the tummy, but obviously she hasn't. On that note, you won't necessarily see a difference in your weight on the scales. It's more about inches. But you can see from the front, we've given her a contour of her stomach, so a waistline, and then from this, and you can see her belly button, how much it's shrunk, and then from the side, you can see how much we flattened her. She was delighted with her treatment results. I'm coming back up to this patient, because this is the patient we showed you in the first photos. And this is her from the back. So it's the love handle area, and you can just see the photographs on the left are the photos that you can, The photos on the left are the photos that you can see pre-treatment, and the ones on the right are post-treatment. This is a really good example of treatment result expectations, and that's really important for us to set.
Expectations, very important.
Yeah, what we can do and what we can't do. This is the last two patients we've been showing you, and treat to complete. So the patient on the left, she's had 2 treatment sessions, and this is 24 weeks, so 18 weeks, beg your pardon, 18 weeks post her very first treatment is the photo, and on the right, and then the other photo is the woman that we showed you earlier. So both patients in their 50s, both patients have had children, and both patients are going through menopause and just struggling to shift that middle. I've never treated them since. They've maintained their results. This is a good example of submental. Now, again, this goes back to, is it skin or is it fat? One of the questions we ask you when we talk about skin or fat is, have you always had it? Does it change if you gain weight or lose weight? This patient is in her 60s, and this was 12 weeks post-treatment. So even in her 60s, her skin integrity was really good. And we can do other things to help sort of contour the jawline afterwards. We can't lift you, that would be surgery. And again, we'll talk to you about that because we're pro-surgery here if we think that's best for you. But this is 12 weeks post 1 treatment session with us. And again, I've never treated her in that area again. Inner thighs. So this patient is in her 40s. She's fit, but always had unwanted fat. She just wanted a nice thigh gap. 1 treatment, 12 weeks apart. And you can just, what you're looking at in these photographs is the space between the inner thighs. So there's a template that we use when we take the photos. So the space between the stamps is the same, but it's the space between the inner thigh that we're focusing on. Tummy. So this patient is in her late 50s. She had 2 treatment sessions with Helena, and we treated her entire back area. Now, sometimes in photos, this area is hard to capture the result, but you can see it on her just in terms of how she's contoured. But what she really notices is when she wears bras and dresses, the lack of the bulge there now compared to post-treatment. And we've just given her a waist. So she has thin legs, thin arms, tall woman, but always struggled with her middle area. This is 12 weeks post her first treatment session. This patient is in her mid-40s. She's had 2 children and just struggled to shift baby belly, we call it. This was 1 treatment session, 12 weeks post, and she was really delighted. And you can see why. It's just gotten rid of that unwanted pocket, and encouraged her to keep on her, I think she was training for a marathon when we saw her for treatment. This is outer thighs. Often when I treat outer thighs, we treat them twice. Sometimes you don't have to wait 12 weeks to have a second treatment. I'll treat as soon as 4 weeks post the first treatment, but it depends on the pocket and the patient, and something we can discuss and agree on during consultation. But this was 12 weeks post first treatment of outer thighs. This patient is actually in her early 30s. This patient is in her 20s, late 20s, maybe early 30s, and this is outer thighs, 12 weeks post 1 treatment session, just always struggled with that outer thigh. So again, you're looking at the contour of the outer thigh. The top ones are pre and the bottom ones are post-treatment. This is all about expectation setting. Arms. So this is a really popular area that we treat next to abdomen. And this patient had just, I mean, every patient says they're my mother's arms. We love our moms, but we blame our moms. And she'd always struggled with her arms. She had 1 treatment session with me, and this was 12 weeks post. She reported that she was numb for 6 weeks, not sore or anything, but just numb to touch. But this is 12 weeks post her treatment results, and she was really ecstatic, and we could notice a difference in inches. We didn't measure her arm, but she had, and she said she had a visible reduction, but you can obviously see it here. This patient is in her mid-40s. I keep telling you age of patients, and I just want to highlight age isn't necessarily relevant to results. There is no age limit. I've treated patients up to mid-70s. The only relevance with age are two factors. One is metabolism. So your metabolic rate slows as we age. So it depends on how fit you are and so on. But you still see results, but they may be slightly slower than someone younger. And skin integrity, like I said earlier. So how your skin will feel. So sometimes on mature patients, it depends on the individual, but let's say 60s to 70s, we might assess you and say it's not best for the arms, because even if we remove that unwanted fat, you'd still be left with unwanted skin. But again, that's the kind of thing we would discuss during your consultation. This patient is mid-40s, and this was arms, obviously, and this is 12 weeks post-treatment. And again, this is a young, fit individual, but just always struggled with that unwanted fat in the arm area. This is a young mum, so she's in her early 30s, but has had 2 babies and just wanted a tighter, smoother abdomen. So we did a treatment that we often do for men, which was to just tighten and lift the area. And on that note, Coolsculpting does also help with skin laxity to a degree and cellulite appearance to a degree as well. So if we're talking outer thighs, backs of thighs, you can expect to see a reduction in cellulite appearance as well as fat. And if we're talking about the submental area, you can expect to see a result in skin laxity as well as fat reduction, providing it's fat to begin with. Men, we do breast area on men. So men, we would treat the same as women in terms of all the areas, but one of the most common areas we treat on men, aside from love handles, would be chest. And that's a male chest, 12 weeks post. And this gentleman is in his mid-50s. This is another good example of submental. So this patient is in her 40s, and it is this area, and you're looking at, so I've aligned the nose and the ear, so we've not sort of done this versus this, but you're just looking at that pocket right there and what we've done to her jawline. If this is probably a better photograph to show you, but it looks like her entire jawline's been lengthened, doesn't it? Again, I think you treated this patient, didn't you, Helena? Questions. So thank you for your time. I feel like
You're talking forever.
Talked at you a lot. And I appreciate your patience with this. I'm going to open up the chat room. If you have any questions, please just type them in. There's a few here. I'm going to give myself a break. I'll read one out and I'll let you answer it.
Okay.
So I know you said treatment isn't necessarily painful, but how will I feel right after treatment?
Well, one thing is how long you're here for. So we usually say if you're here for most of the day, if we're doing multiple areas, it can feel a bit like you've been on a flight across the Atlantic. So because you're literally laying on the bed. You can, if you're someone, you can get up straight up afterwards, carry on with your day. But sometimes you can feel a little bit jet lagged. But then once you're up off the bed, you're fine. You feel this pretty much the same as you were when you got on the bed, maybe a little bit tender in some areas, a little bit numb in some areas, but personally, the numbness, I would feel more the second day. That answers it.
It's like a weird spa day. You can get up in between each cycle, so 30 to 40 minutes. The longest you'd ever have to be still would be an hour and 15 minutes. But there's always, you can get up, go to the bathroom, come back, get comfortable again. We'll provide a catered lunch for you, as well as disposable undergarments, and that's because, and a robe and slippers. The disposable undergarments are because we use a very sticky sort of pad that's lined with glycerol and fructose. So it's very sticky. And it protects your skin from the cold of the template, because remember, we only want to freeze the fat cells, not the skin. And so you don't want that on your own clothes. So you wear disposables, and then at the end of the day, put your own clothes back on. We always say to patients, wear something comfortable, because you don't want to put back you don't want to squeeze into skinny jeans at the end of the
Mm.
day. You just want to put on something loose and comfortable to leave in. You'll feel a bit fatigued, but that's purely because you've just been laying down all day. We'll try and spoil you as much as possible with drinks, beverages, catered lunch, snacks. But we say bring something to do. We don't have TVs in our treatment rooms. So we can provide an iPad for you, but just bring something to read or watch. Some patients bring academic work, and then they end up just watching Netflix and sleeping for the day. So
or audio books.
Yeah.
So if you've got AirPods, that's quite good because you can listen. But then if not, just bring whatever you want to tide the time over whilst you're literally just sitting there and the treatment's working.
Treatment time is dependent on the size of the area we're treating. So if we're treating this, for example, the treatment time can be anywhere from 2.5 to 3.5 hours. That's about fair, isn't it? Maximum. If we're treating the tummy, it can be anywhere from 3.5 to 5.5 hours. Outer thighs, inner thighs, again, it can be anywhere from 2 to 5 hours. It just depends on how much we're doing. Some patients will be with us for a full day. Whatever we do, I like to treat to completion. So I wouldn't start an area and then pause it and have you back in a few weeks to finish the same area. I would treat, if we're treating the front of the tummy, we'd treat it all in the one day. Because you have to wait 12 weeks to see results, you want to have all of it done in as much as you can in one treatment session, because you don't want to have to keep coming back. Right. Next question, cost. Yeah, that is the most common question, and it's one of the reasons why we do these events, to give you as much information as we can, and then we offer a complimentary consultation with ourselves, because cost, it varies on how much you need. It's the starting price can typically sit around £1,600 and go up from there, but it really depends on the area that we're treating and the amount of treatment sessions that are required. But we make that clear during our consultation. And we do offer a 0% interest finance option as well. So no hidden costs, but you can divide it over 6, 10, or 11 months if you'd like. Okay, I have no other questions from anyone. I want to thank you all so much for your time. Sorry about the volume issue at the beginning. I think I accidentally muted myself. This has been recorded, so I will email this to you along with an invitation to come and see either Helena or I at any of the 3 clinics for a consultation. Look forward to meeting you soon.
Thank you.
Thank you.
Bye.
Bye.